Well, good afternoon to everyone. Welcome to the Louisiana Stop Solitary Confinement Coalition's Solitary Confinement Panel, a Public Health Hazard. We thank you for taking time out of your busy day to join us for this very important conversation. Some of you may not be familiar with the Stop Solitary Confinement Coalition. So let me just share very quickly what we are. We are a coalition of community organizations, advocates, families, and organizations committed to ending the use of solitary confinement in Louisiana. Our partners include Unlock the Box, a national campaign that seeks to end the use of long-term solitary confinement by 2028, and the Justice and Accountability Center of Louisiana, which addresses pervasive problems in the post-conviction phase of the criminal justice system. My name is Reverend Alexis Anderson, and I will be pleased to be your facilitator and moderator through the first portion of this. We know that at the end of this, you're probably going to want to do a number of things, and so we want to tell you up front that you are more than welcome to get involved in this important work, and you'll get some directions on how to do that. This particular panel is a public health care panel. There have been a number of movements in Louisiana, including the fact that the governor of this state recently convened a health equity task force. And in that task force was a prison subcommittee, which issued a comprehensive report recommending an end to the practice of using solitary confinement to address health challenges, including COVID-19 in Louisiana jails and prisons, and cited a broader public health threat that results from using punitive isolation as a response to illness. Today, we want to bring the challenges that were identified in that report to you with some opportunities to move the needle. We also want you to know that you will be able to find a link to that report as we go along. We also want to give a big shout out today to Representative Mandy Landry, who was successful in introducing and getting passed HB 344, which was the first change in solitary confinement in the entire state of Louisiana in over 100 years. And at the conclusion of our panelists, she will be presenting some information and sharing with us some of the important work that she has done. So with that said, we have an amazing panel, and we just want to share with you and introduce to you who these awesome individuals are. So we will start with Ms. Ivy Mathis, who brings experience as a directly impacted person to the conversation about public health in our prisons as a formerly incarcerated person. While incarcerated for 26 years, Ivy earned her GED, became a member and leader of Toastmasters, and served as a dance instructor, tech, and event organizer for the institution. Ivy's freedom in December 2018 was the direct result of many years of formerly incarcerated leaders organizing against juvenile life sentences. After historic changes to juvenile sentencing, Ivy was the first woman pardoned in Louisiana under these new laws. Mr. Albert Woodfox is a political activist who spent 43 years in solitary confinement in a cell 6 by 9 feet for 23 hours out of each day at the Louisiana State Penitentiary in Angola. Mr. Woodfox is the last member of the Angola 3 to be released from prison. In 2019, he released his autobiography, which chronicles his experience in solitary, including the mental and physical health challenges unnecessarily created by the inhumane practice of solitary confinement. He is a courageous advocate for the abolition of solitary confinement and travels the world educating the public on the issue. Jenny Lutz is an attorney at the Center for Children's Law and Policy in Washington, D.C., and the project coordinator for the Stop Solitary for Kids campaign. She has worked with over 24 jurisdictions across the country to reduce racial and ethnic disparities in youth legal systems, reduce the use of detention and incarceration, and protect the rights of youth in custody is David Cloud, who is the research director for Amend at the UCFS School of Medicine. He studies incarceration and drug policy through a health equity and harm reduction lens. He previously wrote a report on the solitary confinement in Louisiana prisons for the Vera Institute. Lately, he's focused on harms of solitary confinement amidst the COVID-19 pandemic. So I would like to start with Ivy. My question to you, Ivy, is what is solitary confinement?
Yes, Reverend Anderson. Solitary confinement is the isolation of a prisoner in a separate cell as a form of punishment for 23 hours a day within the prison. Most isolation cells, have a toilet, a sink, and a bunk. Sanitary conditions, unsanitary conditions does exist, and a person can be sentenced to weeks, months, to many, many, many years in solitary confinement.
Ivy, thank you so much for that information. Next, I have a question for Mr. Woodfox. Mr. Woodfox, what is the worst thing about solitary confinement?
I think the worst thing probably would be fighting for your sanity. You know, you're under constant pressure. You're trying to deal with a 9x6 area in which the actual space available to you is much smaller because the bunks attached to the wall and the zinc and toilet attached to the wall and in some cases a table. So it's the mental pressure of maintaining, sanity. For me, each individual reacts to the pressure of being confined to a 9x6 cell differently. For me, it was the mental aspect of it more than the physical, because the fact that, Robert and Harmon and I were looked upon as leaders in the activist community in Angola. Many demands were made upon us, and so that, added to the normal pressure of just being confined to that very small space. And so for me, it was the mental and emotional aspect, trying to, as I say, it was almost every day it was a 24-hour fight for sanity.
Thank you so much, Mr. Woodfox. And I can't say enough. If you have not read his book, I highly recommend it to everyone. Dr. Coopers, and forgive me, am I saying it correctly?
That is correct.
Okay, I wanted to make sure. I don't like messing up people's names. Could you discuss the physical versus psychological harms that solitary confinement can cause and why they are so long-lasting?
Absolutely. First, I'd like to say I'm really proud to be here with this distinguished panel. The first and foremost harm is that solitary confinement perpetuates the structural racism upon which the criminal legal system is built. I'm not saying anything new here. The prisons evolved out of the slave plantation. Today, Black people are more likely than their white counterparts to be stopped and frisked on the street, to be arrested, to be convicted, to have a longer prison sentence. And here is the new piece of information and my point. In prison, they are more likely to be consigned to solitary confinement. I think it's often about guards feeling intimidated by a prisoner, especially a Black prisoner, who is smarter than they are. So the guard feels threatened and throws the Black prisoner in the hole. Then in solitary, in the SHU, that's the California acronym, there is the cell extraction. 5 or 6 officers in riot gear first shoot pepper spray into the cell and then rush in wearing gas masks and slam the prisoner against the wall. Of course, there are chokeholds, injuries, even death. Black prisoners are more often the victim of this kind of assault. The difference with police killing Black individuals in the community is that there are no video cameras in a solitary cell, so the beating or death go unnoticed by the public. Moving on to the general psychological damage, everyone who spends time in solitary suffers painful symptoms. Prisoners with serious mental illness who spend time in solitary find that their mental illness and their disability are worsened by quite a lot. Suicide is epidemic. I have seen in solitary confinement units some of the most disturbed individuals I'd ever met in my 45-year career as a psychiatrist. But people who are relatively stable when they first enter solitary also experience a lot of disturbing symptoms, including severe anxiety, panic attacks, difficulty thinking and concentrating, huge sleep problems, memory loss, mounting anger. As an aside here, I just want to comment, Albert, about Albert has written an absolutely stunningly fabulous book, Solitary, about his experience at Angola State Prison. And one of the things that struck me right off is that you're not resentful. He doesn't seek vengeance. In fact, in the pages of the book, he tries to understand the sociology of these white guards who are torturing him. So I think that's an amazing outcome. For most people, there's mounting anger, and the prisoners tell me, I don't understand why I'm so angry. It just keeps on mounting. There's hyper-awareness, there's an intense startle reaction, there's despair, and of course, there are suicidal crises. Those who spend many years in solitary develop additional problems. They begin to seek even more isolation than their SHU consignment requires. For example, they stop greeting their neighbors and refuse to come out of their cell even for the short time that's permitted. They lose touch with their feelings, describing themselves to me as numb, zombie, or dead. And these problems will likely plague them for a lifetime and severely impair their capacity to function in the community after they're released. I've termed the human damage here that comes from solitary confinement the decimation of life skills. These are the psychological harms, but each of these psychological harms has physical correlates. There are identifiable changes in brain anatomy and physiology, and we can see those on the MRIs and PET scans. Then there is being relatively inactive, idle, not getting adequate exercise, eating starchy and poor prison food, always having to deal with the hostile guards shouting orders and the beatings. All of this adds up to a lot of chronic medical illness, including hypertension, diabetes, back injuries, heart disease, and so forth. And of course, this makes people more vulnerable to the coronavirus. And let's not forget the broken bones and head injuries that resulted from guards ramming the prisoner into a cinder block wall while doing a cell extraction. I'll stop there.
Thank you so much for that powerful information. I want to remind everybody, please feel free to put your questions into Facebook so that at the end we can have them addressed. We now want to move to Jenny Lutz. And Jenny, your question is, does the use of solitary or room confinement differ for youth or have different effects than it does on adults?
Hi, thank you, Reverend. As Dr. Coopers, I also want to say thank you for inviting me to be here. It's a great honor to present with these amazing folks who are on this web call. What I will say is that there are two distinctions about youth solitary that make it a little bit different from adult solitary. But for the most part, the definitions and the impact and also the strategies to stop using solitary are very similar for juvenile facilities and adult prisons and jails. First, solitary is practiced a little bit differently in youth facilities. It's not always a separate isolation unit, and there's not always a long, month or year-long sentence, often because youth cannot be held in juvenile facilities for more than usually beyond their 18th or 21st birthday, as is the case in most states. Not all facilities have a restrictive housing unit or a SHU, so periods can be shorter. And just a caveat to what Ivy said, The Stop Solitary for Kids campaign defines isolation as any period of time where a young person is involuntarily confined for any reason other than an emergency period of isolation that should be minutes or hours to calm down. So it doesn't need to necessarily be 23 hours a day. It can still be very damaging to young people for even shorter periods. Secondly, isolation or solitary is defined a little bit differently in youth facilities. There's really youth facilities don't generally ever refer to it as solitary confinement. There's always a euphemism like room confinement, room time, seclusion, exclusion. And oftentimes the individual facilities have loopholes in the definitions. So if it's not the young person's sleeping cell versus an isolation cell, it might not be counted as solitary. If the door's not locked, it might not be counted for as solitary. If staff can somehow characterize it as for safety, or as because of short staffing, it won't be counted as solitary. So there are issues there in terms of comparing apples to apples when you speak to one jurisdiction and compare it to another in terms of what their use of solitary confinement or room confinement is the most commonly used term. And the two unfortunate byproducts of this fact is data is really hard to come by because again, you're not comparing to apples to apples, and there aren't any national reporting requirements yet. There may be soon as required by the Juvenile Justice and Delinquency Prevention Act reauthorization last year. And there's also a skepticism that youth solitary isn't as bad. It's not like it's the solitary light. It's not as serious and it doesn't impact kids in the same way. And we know, and I want to stress, that's absolutely not the case. All of what Dr. Cooper said about the terrible and long-lasting impacts of solitary confinement also apply to young people. And I just want to stress that these are young people, from the age, often in some jurisdictions, of 8 years old, usually to the age of 17 or 18. So we know that federal data shows that over half of the suicides that take place in juvenile jails and prisons happen in isolation. Their isolation has been very clearly tied to incidents of self-harm. Youth tend to act more impulsively in room confinement than they would in other settings. There's also now a constitutional recognition by the Supreme Court, and also just a common understanding that young people are different. They're not as fully formed. They're still developing socially, emotionally, cognitively. They aren't as able to kind of say, okay, this can't last forever, right? Or someone will eventually come get me. They just don't have the life experience to withstand isolation. Not that adults in any way do, but it's particularly harmful for young people because they are still developing in that way. And the other harm of solitary confinement is that because young people are developing, and because the experiences they have while incarcerated are really formative, we're sending a very wrong signal to young people that will shape them for the rest of their lives. And that is that whoever has the most control or power and can force the other person to bend to their will wins in that situation. And that's not the message that we want to be equipping young people with. We're also, when they're in custody, in isolation, they're not getting any rehabilitation, any treatment, any life skills. So you can't do that when a kid's locked in a room. And just one last point I want to make is that isolation is often used in facilities that are often understaffed for young people that present particular challenges. So it's an easy solution, out of sight, out of mind. And we know that those youth tend to be youth with disabilities, youth with mental illness, LGBTQI youth, and youth of color that staff are not equipped or trained to deal with appropriately. And it's much easier to just stick them in a box for 10 hours a day on a routine basis than to actually deal with them. That's a Band-Aid. That's not a solution that addresses the underlying problem. I'll stop there.
Thank you so much for such powerful information. Now we want to ask Mary Busser. Mary, why do you think the need for mental health services is so prevalent in prison generally, and more specifically in solitary units?
Okay. First of all, thank you very much for having me here today. I feel very honored, and I would also like to thank the Louisiana Stop Solitary Coalition for hosting this important panel because as we've just been hearing just in these few, from these few panelists, what happens that's tucked away and out of sight is just horrific, and it needs to be brought out into the public square. So thank you for doing this. So to answer the question, mental health services are absolutely vital in prison. The incarcerated are estranged from family, from friends, from normal routines, many for decades on end. So it's not surprising that depression, despair is rampant and needs to be treated. And of course, in the shameful absence of community treatment for people with severe mental illness, jails and prisons are the de facto treatment facilities now in this country. So obviously there has to be mental health staff there. Now, during my tenure on Rikers Island, I had the opportunity to have several experiences. I worked as a therapist in the general population, as a therapist on what we call mental observation units for people with severe mental illness, and then as an assistant chief of mental health in the solitary confinement unit. And I can say, based on my experience, that hands down, it is the solitary confinement unit that demanded most of the mental health resources. Now, when I first started in that unit, I remember on my very first day being told if they have no mental health issues before they enter solitary, then they do now. And that proved to be absolutely true. Under the strain of solitary, ordinary people devolve into psychotic states. Self-mutilation is rampant, as are suicide attempts. On a daily basis, our mental health team was called to cell doors where we saw agonized, shell-shocked faces, nooses, blood-smeared cells. This is the reality of a solitary confinement unit. And to go to Dr. Cooper's point, I would add that one of the first things I was struck by when I walked down those tiers, everyone was dark-skinned. There was no question about it. So you see this right with your own eyes, the racism that it pervades right there throughout society, but right into solitary confinement, which is just a torturous state for people to be in. Now, I would like to also add that a recent study, actually a recent report done by the New York Campaign for Alternatives to Isolated Confinement, found that in 2019, suicide attempts in New York State prisons occurred an average of every 2 days in solitary confinement, and that the rate of actual suicides was 4 times higher in solitary than that of the general population. And I don't think it's a stretch at all to assume that these numbers hold for other states as well. And all of this goes right back to what Albert Woodfox said about the hardest thing in solitary and the mental health, holding on to one's sanity, so to speak. And I would just like to add something I think is very interesting. When I first arrived at the solitary confinement unit, I was very surprised to discover that unlike the usual tension between correctional staff and mental health staff, we were welcomed there with open arms. The carpet was rolled out for us. And I was very surprised until I got more acquainted with this unit and learned how heavily the correctional department relied upon the mental health department to keep the place somewhat manageable, i.e. administer medication. And that was what we did. People who were never on meds before were on meds now. And I remember thinking to myself when I first arrived, what kind of a punishment is this that people need to be medicated in order to endure it? It was a very sinister type of feeling, but that's the way it was. We made things manageable. We kept the suicides down. So here we see just how closely intertwined, to go back to your question about mental health services, just how intertwined they are in a solitary confinement unit. And I'd have to say it also begs the question of ethical considerations for the well-meaning practitioners who work in these units. Thank you.
Thank you so much. This is just such powerful information. So, Vic, we now go to you. What is the difference between solitary and medical isolation, and why is that so important during the COVID-19 crisis?
Sure. Everyone hear me okay? Great. So thanks for having me. This is a great panel. Honor to be here. So this question is one that's obviously related to the pandemic that we're all in, which is in so many ways exposing mass incarceration and all of its problems and its intersections with public health. So the recent report that came out from Solitary Watch and Unlock the Box was documenting just incredible spikes in the use of solitary during this pandemic. And at Amend, at my job and all across the country, we get emails and we're hearing from people every day who are worried about loved ones who have been infected with COVID and have basically been put in solitary and can't communicate with their family. So this is a real thing, and it's getting worse before it's getting better. So it is really important for us to unpack the distinctions between what solitary confinement is and what medical isolation is. Medical isolation is a public health measure, and its purpose is really just to separate people who are confirmed or suspected to have a diagnosis with the disease, here COVID-19, until they're no longer contagious. That's different from quarantine, which is generally when a person, you're separating them because they're still asymptomatic, but you think they might be exposed, and you're separated while you're waiting for them to see if they develop the condition, the infection. So those are the basics. And what we wanted to do at Amend, and we've been trying to do this and like through policy briefs, webinars, and whoever will listen to us, is drawing very clear distinctions. The only thing that solitary and medical isolation should ever share together is the physical separation of people from one another. The purpose of medical isolation is to prevent the spread of disease. The purpose of solitary confinement, as everyone else here has just laid out very eloquently and powerfully, is to punish and dehumanize people. The length of stay in medical isolation, that is something that is governed by science and medicine and testing. So, for example, if someone's put in medical isolation, they should be seen by a doctor regularly, have testing, rapid testing, and determine if once their symptoms are gone and their tests are negative 2 consecutive times, medical isolation is over. That's in contrast to solitary, which we all know is governed by often very vague policies and the discretion of correctional authorities. Any medical isolation setting should be overseen by medical professionals and guided by medical ethics. So that requires nurses and doctors running the show on the unit, not correctional officers, not security. And this is one that I'm particularly concerned about, is really just the conditions. I think we're hearing a lot of stories of people who are being removed to a solitary unit just because prisons are so crowded. And I think the officials are like, oh, this is the only space we can use. So they're moving people down there, but they're operating it just like they would on any other given day. And so from a perspective of medical ethics, like conditions to do medical isolation ethically, like it should be sanitary. There should be adequate lighting. There should be proper ventilation. It should be clean. So those very basic things, which we know a lot of solitary confinement units are missing, need to be there to do medical isolation ethically. And then other amenities. I mean, it's just like any of us in the community that are home, or if we get exposed and we need to be somewhere we're isolated with this kind of scary disease, we don't know how it's going to play out. All those basic things that help us pass time and get to some of the idleness. So television and book, being able to communicate with your family regularly. Those regular things are essential for anyone in medical isolation. We know that people in solitary don't get them. So those are some of the key distinctions. They're very different. Medical isolation, again, is a public health thing. Solitary confinement is the antithesis of a public health thing. And I just want to quickly point out that, to operationalize this vision of medical isolation, it's only possible with bigger structural actions. So depopulation of prisons, it's really hard to implement a medical isolation policy that doesn't rely on solitary units and doesn't subject people to inhumane conditions unless states are willing to ramp up their depopulation efforts. There's got to be abundant access to diagnostic testing, because only the best decisions can be made, again, with medicine of when it's safe for people to mingle, when it's safe for them to be out of isolation. And then, on corrections officials, like this is a moment of crisis where they should be doing everything in their power to remove any barriers to people having an enhanced ability to make phone calls. So waiving phone fees, getting rid of medical co-pays, bringing in televisions, tablets, like extra. They should be going out of their way to show compassion and going the extra mile. And I think that's something for folks who are going to remain and aren't getting released. We know not enough have. There needs to be advocacy to make sure that they get those things. And then finally, I'll just say, open the option for care in the community. I think like some prisons and solitary units specifically are just frankly not equipped to do this ethically. They don't have the infrastructure or the staff. So there just needs to be stronger policy and more open structures to get people care and outside the prison system if they test positive and need to be medically isolated somewhere else. I'll stop there.
Thank you so much, David. Ivy, I want to go back to you and I want to ask you, do you agree with the use of solitary confinement either to stop COVID-19 or to manage prisons or jails generally?
Well, I think we all would agree that there should be laws, rules, and policy that governs the land, whether in prison or in society. However, the injustices come when the penalties are not universal. And I'm speaking on a scale racially wise. Most prisons are not designed to have large solitary confinement housing areas. And being that solitary confinement is for punishment, I do not agree that COVID patients should be housed in solitary confinement as a form of punishment, because they should not be punished because they've contracted a virus that they had no control over, that they could not prevent themselves from getting. And you know, they can't do the things that we've done in society to protect ourselves. They have no way of controlling this in prison, and to place them in solitary confinement, no, I disagree with that. However, I do agree with isolating someone to prevent the whole general population from contracting the virus. But in the very beginning, preparations should have been made, because it was inevitable that this virus was going to sweep through the world. And of course, it didn't exclude the prison populations. Those preparations were not made. And so now many prisons are scrambling for places to house people and jeopardizing people who are not sick, jeopardizing them, and they're contracting the virus. So this is a yes and no answer for me.
Thank you so much, Ivy. So, Mr. Woodfox, do you think that Louisiana's prisons and jails will ever stop using solitary confinement for prolonged periods of time? And why or why not?
Well, voluntarily, no, because solitary confinement is such an effective tool that prison security is likely used to control prison population. The threat of being the term they use, "I'll lock your ass down," you know, is so prevalent throughout the prison between security staff and prisoners. To add to what Ivy just said, one thing that's distinction I like to draw is, at one time, solitary confinement was a means of punishment in the prison system. Now it is becoming a means of housing, where prisons are being built for the purpose of, you know, solitary. And the question arises, when a person who is placed in solitary for being infected, nothing changed. Nothing, absolutely nothing. You're still in the cell for 23 hours a day. You still get the same lack of medical care. You still get untrained officers. Usually they are very racist, you know, so, you know, I understand what everyone is saying and the research that's being did, but I've lived this for 40-something years. So my point of view has come from experience, being a victim to this, you know. And the thing, and I've always said that there is a difference. If you know, look, there are people who are going to be a problem in prison and society, no matter what we do. How we respond to that, how we treat them, and there's a difference between separation from an environment or that the prisoners are in, and isolation or solitary confinement, as we call it, you know. And so, as Sister Ivy said, the Department of Corrections attitude towards solitary, no. I think, for one, there's no oversight. There's no meaningful oversight of the use of solitary confinement. It's a very effective weapon that they use to terrorize and control prison population. It has no penological value other than, as Dr. Cooper said earlier, than to break the human spirit, to destroy one's integrity, self-respect, you know. I've seen guys in solitary have been reduced morally to throwing human waste on each other to deal with the frustration and the anger. Imagine that, you know. Animals, some of the most vicious animals in the world, don't use that as a means of fighting. To be reduced to the level where you would take your own waste and your own urine and use it as a weapon, you know, it's disgusting, you know, and they encourage it. You know, some of the most destructive behavior in solitary confinement is allowed, encouraged, you know, because it gives them, you know, that's, you know, it gives them the false moral standard of saying, see, I told you so, you know. They create an environment in which people are going to act a certain way, and then they turn around and use that to justify, you know, the existence of solitary confinement. So you know, I don't think it's necessary. I think it should be completely ended. And until that day come, I think it should be severely limited on how long you can put someone in solitary. And that's, you know, me myself, I've been locked in solitary and then in the dungeon, which is a more cruel or solitary, you know, because of the few things you are allowed to have when you're in solitary population are completely taken away when you put in the dungeon, that we call it, our isolation, as a term they, you know, the prison personnel use, you know. And, you know, Robert Herman and I filed suit in 2001 about long-term confinement. And we got one of the first rulings in which the court recognized that people held in solitary confinement after a certain amount of time had a 14th Amendment right to come into the court, you know, cruel and unusual punishment and meaningful due process. And up to that point, you know, there was no restrictions on prisons, personnel or security on who they put in solitary for how long or whatever, you know. So no, you know, it's too big a weapon for security forces in prisons to use to be voluntarily stopped. You know, it's going to take some oversight and maybe legislative action to put some kind of a limit on the use of solitary confinement. And those limits should be moving toward eventually eliminating the use of solitary itself. You know? So no, I definitely do not think there's any reason to justify it. I stayed in the cell 44 years and 10 months for no other reason than my political beliefs and my association with the Black Panther Party and my fight for humanity, not only for myself, but prisoners throughout Angola and around the country. And, you know, that was the only reason, you know. I had conduct, I had a 20-year span in which I did not receive one disciplinary report. But yet I was still being portrayed by the infamous Burl Cain, who's now the head of the Department of Correction in Mississippi, as the most dangerous man in the world. And for what? Because I didn't want to be treated like an animal, because I demanded respect, And so these are, these are the type of things that comes out of solitary. And to go to what Dr. Cooper said, I'm thankful for the fact that I was able to fight and maintain my sanity, and that I was able to come out and expose to the world through my book what goes on, because the men and women and children who are hid behind the walls of solitary confinement, nobody knew it about it. At least now we have a dialogue, a national, international dialogue, based upon our work and the work of so many other wonderful men and women, both inside and outside the prison. But there's a part of me that you don't see. To go to what Dr. Cooper said, I have panic attacks. I have disorientation. There are times when I wake up and for a brief moment, I don't recognize where I'm at, And I have moments when a thought is on the tip of my mind, but I can't bring it, out. And so I know, I still suffer from claustrophobia, So there's, I'm happy to be able to maintain my sanity and my dignity and my ability to socialize and adjust to whatever environment I'm in. But King and I always laugh, we say we the worst case scenario for ending solitary, because we look at it that we are the exceptions, to the rule. We are the men who found the internal strength to turn ourselves into something that it wasn't meant to be. My cell was meant to be a death sentence. I turned it into a high school, a law clinic, debate hall, a university, But it took decades for me to do that, And one of the things that I, made a promise is when I went free, not if, when I went free, that I would be the voice and the face of the men and women and the children that's being hid behind the walls of solitary. And that's why I'm so honored to be here today, to be, among such distinguished panel, try to, raise the level of consciousness of society as a whole. And hopefully, what we're doing here now will be successful in doing that.
Thank you so much, Mr. Woodfox, for all the amazing work you have done. So we're going to ask Dr. Coopers, why should solitary confinement be considered a public health issue that everyone should care about?
Well, first of all, let me say, I can't overstate how inspiring it is to be in this struggle with Albert Woodfox. Solitary is absolutely not an effective way to control coronavirus contagion, as Ivy and David have pointed out. Look at the recent experience at San Quentin Prison. The prison had no cases. Then the California Department of Corrections transferred 120 prisoners from a different prison where there was an outbreak. The transferred prisoners were put in the adjustment center, which is the notorious supermax solitary confinement unit. Within weeks, there were over 1,300 cases of coronavirus infection at San Quentin and several deaths. It does no good to separate prisoners at risk for from COVID-negative prisoners when the guards, who often fail to wear masks and wash their hands even, go back and forth between the infected prisoners and the others. And that's only one way the contagion spreads. We as a society disappear into our prisons the social problems we do not have the will to solve. For example, we have been slashing public mental health treatment budgets for decades. So individuals with serious mental illness fall into homelessness, and then people don't want to watch them suffering on the streets, so they lock them up and throw away the key. But the coronavirus foils our disappearing act. The disappeared prisoners get sick, and then the disease spreads back into the community. COVID-19 is not the only disease that finds an incubator in the prisons. The most widespread and serious public health hazard of mass incarceration and solitary confinement is social failure. Time out for a moment. As an aside, I want to present a viewpoint. The best antidote to mass incarceration would be the drastic downsizing of jails and prisons. This can be accomplished with sentencing reform, restorative justice, diversion to community programs, and so forth. That's my aside. Now back to the problem at hand. Instead of downsizing the prison population, a large proportion of prisoners, disproportionately prisoners of color again, are consigned to solitary and denied the opportunity of rehabilitation. After spending an inordinate amount of time in a sterile cell with no window, they are denied access to the programs they need to prepare for life back in the community. And 93% of prisoners are eventually released. The notion of lock them up and throw away the key is really about throwing away people. For those left in the prisons after extensive decarceration, we also need to end solitary confinement entirely, especially during the pandemic. Placing prisoners in solitary confinement is simply cruel and unusual and a form of torture. Bottom line is, we as a society need to do everything possible to make certain that what we do to individuals behind bars serves to diminish rather than increase the likelihood they will be damaged and resort to substance abuse and crime anew after they are released. Solitary confinement, whether it be consignment to SHU or absolutely foolhardy isolation in reaction to the pandemic, has the effect of increasing the likelihood the isolated prisoners will be damaged by the isolation and fail at going straight once released.
Dr. Coopers, thank you so much. Ladies and gentlemen, I want to again thank our amazing panelists, Ms. Ivy Mathis, Mr. Albert Foxworth, Dr. Terry Coopers, Jenny Lutz, Mary Busser, and David Cloud for giving us such amazing information. I have been your moderator, Reverend Alexis Anderson with PREACH and the East Baton Rouge Parish Prison Reform Coalition, and it has been my honor and my privilege to stand in the stead for all of these wonderful experts. And now I would like to transition to the Executive Director of the Justice and Accountability Center, Vanessa, if you would take it.
Thank you, Reverend Anderson. Thank you, everybody. We're going to transition to our Q&A. But first, I would like to introduce the illustrious Representative Mandy Landry, who carried our Louisiana Stop Solitary Coalition bill this session, which we actually passed, which I think everybody was surprised by. So Representative Landry, why don't you give us a few words?
Yep. Hi, everyone. I am Mandy Landry. I represent District 91 in New Orleans. It's the Irish Channel, Milan, sort of uptown Holly Grove district, and I'm new. And this is great that this happened. And I think getting it through, and especially with so many co-sponsors, I think we had like 40 or something on the House side, shows that people are really listening to criminal justice issues. And I also just think strategically, starting this slow march with pregnant women was, even the people who question everything I do there could not say no to this, because it's just egregious that we had to have something in the law that says don't put a pregnant person or someone who's just given birth in solitary. And I think it gets people thinking about the issue a little more. And everyone supported it. A handful of people didn't vote for it because they vote against anything having to do with criminal justice reform. But I think that was positive. And I think, we should really think about the next step. It probably won't be till the spring. If we go into session again in the fall, it's probably going to be another CARES Act or financial session. But next year, I only get 5 bills, and I have a reserved one for y'all. So don't tell anyone. because that's 20% of the bills I get next year. But I reserve one for y'all, and just, keep me in touch with what you're thinking about and what has worked in different states. But I really think, pulling on the heartstrings a little bit and pointing out just the extreme torture and the health risks to certain people will really get some more support for it. And next time, hopefully we will be in a regular session and not a COVID session, and we can start earlier with sponsors, co-sponsors and co-authors, and get a lot more traction before we even present it. For those of you who watched this year, everything was rushed. It was so fast. Got this passed on the last day, and it was a weird year for everyone, but knowing that we got it through, I think we can start even earlier next year. So thank you, Vanessa, for reaching out and coming to testify as well. And I am happy to be part of this. Thank you.
Thank you so much. Yeah, and next year when it's not a COVID session, everybody's coming. So we had 300 people lined up to testify, but the mask thing wasn't a thing yet. So next year it's on, Louisiana legislature. All right, so we have a couple questions from Facebook, and we have some other questions that we had for our panelists. Ms. Jenny, why don't you tell us a little bit about some successes that you've had in curbing solitary confinement? I know you said early on that it may look different for kids and adults, but the ways to stop it are the same. So why don't you give us an example of something that's been effective for you to do that?
Sure. So I first want to make the point and underscore that most adults and young people should not be incarcerated or detained to begin with. There's a lot that can be done, as Dr. Cooper said, on the front end in terms of diversion, detention reform, and implementing and investing in community-based solutions that are more effective, and they're also more cost-effective. So in general, places that we have seen that have been successful at limiting solitary for young people share an understanding that there's an underlying reason for any behavior that happens in a facility, and also that being locked in a cell magically doesn't magically address any kind of issues, whether it be on the facility's part in terms of not having the right services, not having enough staff, or admitting the wrong youth, so youth with serious mental illness. Or whether it is an issue with youth behavior. That's not how we would discipline our own children or teenagers or even ourselves and expect just magically that we're going to reemerge from an isolation cell hours, days, weeks later, kind of understanding more or being deterred from the same behavior. The real solution is having relationships that are respectful between staff and youth, doing real work that's not whether it's clinical work or reform work, it's not just slapping a Band-Aid on the problem and out of sight, out of mind, and warehousing people in solitary confinement cells. Another strategy that has worked in several different jurisdictions is when states, facilities, advocates view solitary confinement as a holistic, interconnected issue. So really, solitary confinement is a very visible symptom of a much deeper underlying problem that exists in facilities and in the United States correctional system overall. And it's very linked to overall facility safety, including the safety of staff. As Dr. Cooper said, young people and most adults get out, they return to their families, they return to their communities, and if they've been denied access to everything that we want to give our young people in the community, our own children, to shape them into healthy, productive adults that can really fulfill their own potential. And if they've been denied that in their teenage years, that's going to ultimately impact community safety and also public health. So it's not just about what happens behind those doors. Prison health is public health, at least definitely from the youth side and the adult side as well. I just want to mention, we did publish in June of last year a resource called Not in Isolation: How to Reduce Room Confinement While Increasing Safety in Youth Facilities, which profiles 4 different jurisdictions who've been successful at reducing or ultimately eliminating solitary confinement. And some of the things that they've done in those jurisdictions is oftentimes it's legislation or litigation, but that alone we found has not been enough to do it because it happens on an interpersonal level. You can have the best bill or the best policy in the world, but if staff aren't following it on a daily basis, people are still going to be in solitary confinement. So some strategies that have worked have really been investing in programming, so keeping young people and adults busy, giving them opportunities that are valuable and meaningful, creating training for staff on verbal de-escalation, and trying to help staff understand the manifestations of behaviors, that it's not necessarily people are being defiant, but that there may be mental illness or trauma at play. Having the effective and engaged use of mental health professionals, which often does not happen at all in youth facilities. Using data in smart ways to try to figure out why is isolation being used and what are the strategies that facilities and jurisdictions can implement to stop its use. Also thinking effectively about how to message reducing solitary confinement to staff and systems folks. So convincing them, showing them that there's another way to do things that will make them safer, and getting in that strategy, getting them on board with the idea that having fewer people in prisons, period, will change a lot of the way things are being done. It's hard to imagine and believe in something if you've never seen what it looks like, and that is in part why we created the Not in Isolation resource. And then finally, creating, whether it's through legislation or policy, structures that will hold staff accountable to policies. And because you can have a great policy, but if you're not practicing it, again, that's still a very serious problem. And also creating local and state oversight. I'll stop there.
Great, it's a lot of work. We got a lot of work to do, guys. All right, Albert, we have a couple of questions coming in for you. I'm going to combine these two questions into one. The question is, if you could discuss how your politics gave you strength to maintain your sanity and dignity. And we also have a question about the food.
Well, you know, I've always said when I was a young man, a teenager, you know, my mom fought so hard to instill in me certain qualities of humanity, just willing, you know, sacrifice, discipline, integrity, self-respect. And of course, you know, I rejected these things. And there was this battle going between the voice of the street and the voice of my mom. And of course, the voice of the street was much louder. And eventually in my life, it was the voice of the Black Panther Party versus the voice of the street. And I'm happy that, of course, you know, that the voice of the Black Panther Party was louder than the voice of the street. So that was the beginning. But at some point in my life, when I began to shape the kind of human being I wanted to be, the kind of man I wanted to be, I realized that the foundation in which I stood on was that foundation which my mother instilled in me. Even though I rejected it, it was still very much a part of me at some subconscious level. And so when it was needed, you know, it came to the forefront, you know. And I realized why, you know, other men and women throughout history and the books I read and stuff, you know, were heroes. I realized that my mom was my one voice true hero, you know, that she instilled in me the very foundation that allowed me to become the human being I am now, the man I am now. And as far as the food, what can I say, you know? The quality of the food usually determined the inmate cooks they had. You know, everybody knew that a certain crew worked on a certain day and the food would be edible, as to some people who just didn't care, you know. But overall, you know, you had dietitians who were more concerned with making the food stretch than the nutritional value. There was an idea, you know, the thing about prison, there are a lot of things in policy, but not honored or upheld or practiced by prison people. You know, I've always said it seems as though people involved in correctional work and in law enforcement have less respect for the Constitution or statutory laws that are designed to move society forward. And so you have that problem, you know. You know, so the food is not even worth discussing. You know, it was always, most of the time it was horrible. The time that it was edible was based upon the prisoner cook's than the quality of the food itself, you know.
All right, thank you for that. We have another question, and I'm going to direct this to Ivy. And Ivy, I don't know if this is something you feel like you can answer, but this is kind of, we talked a little bit about narrative change, and the question seems to be, how does a parent or a family or a loved one change how the prison personnel see someone from like just a criminal to someone who may actually have real mental health issues? Do you have any like advice, you know, either for individual family members, how they can help make that happen, or, you know, on a systemic level, how we can kind of change that perception that people have once people are convicted that they're like always criminals?
Well, everyone is entitled to their own opinion, and you can't really fault people for the way they feel. But what I've learned, I'll use my situation. My mother, growing up as a child, she always believed that anyone who breaks the law should do the sentence. You broke the law, you did the crime, you do the time. But then there came a point when I got in trouble, and trouble came into our home. And when trouble came into our home, then her perspective changed. Because see, she wanted mercy for her child. But now you're not viewing it through society's view, you're viewing it through your own eyes, which is, this is your child. And so I'm no different than anybody else who have broken the law, because I am formerly incarcerated. I'm no different from anyone else who have broken the law. But then her perspective changed. So I believe that for most people who are just not genuinely compassionate at heart and really care about people, and people who are just able to look beyond someone's fault and see the good in spite of the bad, we have very few people that are able to do that. But a lot of times when trouble hits home, that is the only time that a lot of people's perspective change. When now I need help for my family, I need help for my loved one. And so, yeah, until it's, you know, until it hits home, or unless you're just a person who has a genuine heart where you really care about people, until then, you know, yeah.
Yeah, thanks for that. All right, Mary, this next question is going to be for you. We've heard a lot, I mean, prisons and jails use solitary, right? And it's increased since COVID started. So we got to assume that they think it works, right? Because they use it. So, but does it actually work? I mean, prison and jails presumably use this as punishment to stop COVID for a whole bunch of reasons. Do any of the reasons that they use it actually achieve the goals that they want to achieve? And why or why not?
Well, I'm sorry, can you hear me? I'm not entirely sure of the answer on that, because I don't know exactly what the numbers are. I think there is a desire, it depends on people's political agendas. I think there are a lot of politicians who view this as a solution, who are not looking hard at what the suffering is. I think it really has to do with just how you measure this. I know when I worked on Rikers, there was a tuberculosis outbreak, and I can say what it looked like on the inside. It was horrendous, that the people who had it or thought to have it were viewed as monsters, were alienated, ostracized, targets of abuse. Everyone was fearful of contracting it. It is a terrible way of managing disease. It's absolutely terrible. And it's particularly in New York State, I think that really there's been a bad job done of just kind of ignoring the needs of people behind bars.
All right, thanks for that. David, this next question is for you, especially because, you know, you've worked with the Louisiana DOC. What are the most persuasive arguments that we can make for getting prison and jail people to stop using solitary?
Or I think there's no one singular way to get to the kind of minds and hearts of people who work in jails and prisons. I think it takes a kind of to be very savvy about all the different kind of arguments you can make and who they need to be tailored to. So I think, first off, like just conveying the human toll that it takes on people. I think continuing to do that, hear the testimonies of folks like Ivy and Mr. Woodfox, and get that into the public conscious. I think that starts to create a type of pressure from a public sphere onto DOCs. And I think like more at a more granular level, like when you're working and you're trying to change the mind of someone who has control over these types of policies, you have to debunk a lot of the preconceived notions they have about solitary. So, it keeps us safer. It keeps violence down. It deters it deters infractions. I mean, there are studies that show that it does not do those things. It actually is a driver of violence more than it is stemming violence. So I think that's really part of it. And I think like if you can show places where I've worked, Louisiana and other places, but where you can kind of feed them back their own data to show them otherwise and show them what's going on. They don't take the time to actually look at their statistics, to talk to people, to gather information, really learn what's going on. So I do think that's one approach. And I think it was Mary, I can't remember who said this, but like you can have the best law and policy in the world, but really getting down to requiring the people who are responsible for implementing those policies to get them to buy in. We've found in our work, one way to do that is to try to focus on the occupational health of some of the guards and the COs. So like, you don't want to work in a unit where people are smearing blood and waste on the walls, where they're screaming, there's a cacophony, like it's a shared environment that they have some control over. But I think once you start to show them that it doesn't have to be this way, and if you can show humanity to the people that are in your custody, and some of that comes back. So it's about that, finding that mutual respect. And places we've worked, like such as North Dakota, some in Louisiana, like you start to get like better vibe to start to change and flip the way that some hardened correctional officers think about this. Like it's really hard to undo the kind of training they have, especially what's like 3 weeks of training. You get your keys, you get your cuff, you get your badge, and you go to work, So it's like they're more structural, fundamental part. But I think that occupational health angle is one that at least folks in public health, like, at my shop, we have to go in and focus on that and get them to realize their own trauma, their own like drinking and things like that come with just going to a job that is really stressful. And if you can flip things around and get rid of things like solitary, like it's better for everybody. It's better for everybody. And then I'll just say, I think, like every place I've worked in, there's always like the looming litigation and legislation too. So I think it's important that pressure is important. And I think like, especially like just the tireless work of people who've been doing this for decades, like you've seen a shift, and you've seen even some of the correctional associations start to tinker with ideas. And I think there's, at least at one point, like, in the old DOJ, there was a sense that there might be like some more federal guidance and stuff like that. So I think they pay attention to that. So just being knowledgeable of how you can kind of pin each of those things together and know the administrators, know the wardens, know the people that know what gets to them. And then you can talk about cost, but I actually like solitary is more expensive, but I also like sometimes caution with that, because solitary ultimately exists for many reasons because of fundamental lack of investment and resources in people. And so like to get rid of solitary, you need enhanced programming, you need more services, you need more rehabilitation, you need to invest in people, you need to invest in community. So it's like, you can use that strategically to, I think, get people's ear, but to be like candid about it, you have to be honest that we're talking about reinvesting on people that have been marginalized and disinvested in for so long.
Mm-hmm. Well, that's hopeful. Thank you.
Can I just add something?
Go ahead, Mr. Woodfox.
Yeah, I'd like to add.
No, the thing about solitary confinement is there's no oversight, there's no accountability, and there's no punishment. and that's kind of like in law enforcement thing, you know, this qualified immunity doctrine, you know. If I can do something and know I can get away with it, then what's to stop me from, you know, no amount of training is going to change that attitude I'm going to have, you know, because I know if I can beat a prisoner to death or beat him into submission and nothing can be done about it.
Yeah.
Before he's trying to get on my wrong side, or I come to work one day and I bring problems from home with me or problems from society with me, you know, I'm going to be abusive. I'm going to use that power I have. You know, there's a thing we used to call it the wide earth syndrome. You know, when these cadets would come out of school and they come and work around us, they would be very tentative and they want to, you know the prisoners and get along with them and stuff. And then after a couple of weeks of indoctrinated by the culture of the prison, they would come down to tear the count and they would walk like, you know, you've seen these old westerns where they come down and like two gunfighters meeting in the street and they come down and they got this certain pose, you know. So, you know, we came up with this term, the wide earth syndrome, you know, and we've seen it over and over and over because there was no oversight, no accountability. You know, and the only real way you can change prisons is through the court system or legislative, you know, pass laws and then have people. It's important for oversight from committees that come from society to come in. You know, a lot of families I spoke to it earlier. They think prisoners come from another planet. They forget that we come from mothers and fathers, and we have brothers and sisters and grandparents and stuff, and that we made a mistake, you know, not to get into the economics or the Constitution or the laws of society, you know. We're still human beings, you know, and we respond to positive treatment. We respond, you know. I will respond, or I did respond to correctional officers who came to my cell and treated me with respect, as to correctional officers who came there and tried to handle me in a degrading way, you know. And I can't tell you the times I've had to say, don't talk to me like that, you know. Or they'll come to my cell with their gas canister in their hand, you know, as a way of trying to intimidate me, you know. So, you know, it goes beyond just the training. The training is the first step, and it's very necessary. But accountability has to play a part of that, and they have to know that they can't, you know. I mean, we live in a society now where a traffic ticket carries the death penalty.
Mm-hmm.
You know? That's you know,
yeah.
it's just so despicable. And we have this thing going on in society right now where you have people out there because of the lack of leadership from the elected officials saying things like, well, I think wearing a mask is a constitutional violation. They don't even know what the Constitution says. I think these laws are the, and they place more value than going to the beach or going hang out in a bar room or concert or whatever than they do on saving the lives of the people in this country, you know?
Yeah. So
it would be one thing if they can, you know, if I can catch the coronavirus and it affects only me, hey, you know. But this is the thing where you have you know, you are in a position where you can infect hundreds, thousands of people. You can cause death. So we need to start, you know, thinking in terms of how valuable is life to us. You know, that we think going to a bar room and getting drunk is more important than protecting our neighbors, our own family. You know, because if you go to a bar and get infected, it don't stop at the door. When you come into your house, you're infecting your wife, your kids, your mother, your father, whatever. You know, and I don't see that kind of advocacy being said by people who need to say it. You know, this is not just about you. It's not about your constitutional rights. It's not about your legal rights. This is about death and sickness.
Absolutely. Absolutely.
I just thought I need to put that out there, you know.
Yeah, thank you. We are past the 1:15 hour. I know we could probably talk for like 3 more hours. I did want to put the call out. I think Shamitria is putting in our Facebook comments. The governor today at 2 p.m. is having his weekly radio show. So if you are not busy in about 43 minutes, please give him a call and ask him to close Camp J, to stop using solitary, to endorse the prison subcommittee recommendations from the Health Equity Task Force, and ask him to ask the Department of Health to put up this memo that was up for 24 hours that said, prisons and jails in Louisiana, if you can't keep 6 feet of space between people, you need to start releasing people.
Right.
That memo was written by the Louisiana Department of Health and was posted for about 24 hours. We downloaded it, so we still have it. They need to put that back up, and we need to start caring for people like Mr. Woodfox was talking about. So maybe we'll have a follow-up panel. If you still have questions, we can also get them to the panelists and get you responses. But thank you again, everybody, so much for your time today and for your tireless work. We must have 200 years of experience and knowledge on this panel right now. So thank you all so much. Take care of yourselves, and everybody take care of yourself out there too.